Hello, everyone. I'm delighted to welcome you to today's webinar, Reimagining Commitment to Fighting HIV, TB, and Malaria During COVID, with a focus on private sector. Thank you for joining us. I'm Nancy Wildfire Field, the president of GBCHealth, the Global Business Coalition for Health. GBC has been working with companies for nearly 20 years, leading the business fight to address some of the most pressing global health challenges, and particularly around HIV, TB, and malaria. We do this in part by creating platforms like this to learn from each other, to share experiences of what works with the challenges, and to collaborate on solutions that generate tangible results and impact in the workplace, in communities, and as global citizens. We're hosting this event in collaboration with two of our programs, the Private Sector Constituency to the Global Fund and the Corporate Alliance on Malaria in Africa. And I'm very pleased to be joined by my esteemed colleagues today, and a special welcome to our members who are on the call. We would also like to thank our partner, the Global Fund, who helped organize this webinar, and of course, thanks to all of our speakers and to everyone in the audience who is joining us today. As we know, COVID-19 is having a significant impact on the fight against three other infectious diseases, HIV, TB, and malaria. A recent report from the Global Fund found that COVID-19 could cause deaths nearly to double in the next 12 months from these diseases, unless we take immediate steps to mitigate the effects of the pandemic. 3/4 of the Global Fund programs are experiencing disruptions, and these could threaten decades of progress, pushing us back to those levels at the peak of the epidemics. Over the course of today's webinar, we will look at the impacts of COVID-19 on malaria, HIV, and TB interventions and explore mitigation strategies to protect these hard-won gains. We will look to our private sector partners to share best practices for how they are addressing COVID-19 in their workplaces, in their communities, and beyond. They will share some ideas and solutions for how companies can harness their core business strategies to respond to the increase in HIV, malaria, and TB cases today. The private sector has and continues to be an indispensable advocate, partner, and stakeholder in addressing these epidemics and other health issues, and has been instrumental in addressing COVID-19 in a myriad of ways, including raising funds and supporting national responses, investing directly in primary health care, taking critical steps to protect their employees and their communities, and leveraging their capabilities in manufacturing, communications, and supply, including innovation in new treatments and vaccines, scaling up other health products and supplies, and helping to address PPE shortages. We have an amazing lineup of speakers, and we'll start off with a fireside chat between Peter Sands, the Executive Director of the Global Fund, and Dr. Tadase, the Minister of Health from Ethiopia. We're pleased to have Sherwin Charles as moderator of this discussion. Sherwin is the Global Fund board member for the Private Sector Constituency and co-founder and CEO of Goodbye Malaria, South Africa-based initiative which is focused on fighting that deadly disease. We will then move to a panel of civil society and private sector partners with representatives from a diverse group of companies, and I'll introduce them in the program a bit later. Before we formally kick off our discussion, just a few logistical notes. One is, if you have a question for our speakers, please send it through the Q&A tab on your Zoom platform. We'll be collecting and answering the questions in the latter half of the webinar, and we'll endeavor to answer as many questions as we possibly can, including those submitted during the registration process. Today's webinar will be available on demand on YouTube in the coming days, and other relevant content, including key takeaways, and a link to the recording will be shared with all those who are registered. We also encourage you to use social media to share comments and insight from today's webinar, and the hashtag is Reimagining Commitment to HIV, TB, and Malaria. And finally, we will compile some key outcomes and actions that result from today's discussion and continue to reach out to the growing number of businesses who are striving to navigate this space individually and in partnership, helping to build healthy societies healthy communities, and more resilient health systems. Stay tuned for future announcements on that. So without further ado, I'm pleased to welcome Sherwin Charles, who will lead our keynote discussion. Sherwin, Peter, Dr. Tadesse, please turn on your cameras now and unmute yourself. And I'll be back to kick off the panel discussion following the fireside chat. Thank you very much. Sherwin, over to you.
Thanks so much, Nancy. I have the great honor of welcoming Peter Sands and Dr. Tadesse, who's the Minister of Health from Ethiopia. I think we find ourselves in unprecedented times. COVID has spread across the whole world, especially now starting up on the African continent. We seem to have lagged what was happening in the rest of the world, but unfortunately, speaking from a South African base, we see it in South Africa now spreading. And I look forward to the conversation with Peter Sands, who really has been leading the Global Fund's charge at this important time. Dr. Tadesse, as the Minister of Health in Ethiopia, where we've seen the country very successfully combat this pandemic. Peter, over to you. The Global Fund has taken a strong role in combating COVID-19 by making available up to $1 billion for countries to utilize in their fight against COVID-19 and in ensuring that the programs for HIV, TB, and malaria suffer the least amount of impact. What is the potential effect of COVID-19 on the three diseases? And why do you see the Global Fund so well positioned and being able to very quickly address the pandemic?
Thanks, Charles. And it's great to be with you and also with Minister Tadesse, who I was not too long ago. It seems like a different world, though. Pre-COVID, we were together in Ethiopia. To your question, the first thing is we have an incredible amount at stake right now, not just in terms of the lives that could be lost to COVID itself, but the lives that could be lost because of the knock-on impact on other diseases. It isn't just HIV, TB, and malaria. Of course, that's what I'm focused on. It's also maternal health. It's also immunization and so on. But even if you just look at HIV, TB, and malaria, I mean, if you look at some of the analysis that UNAIDS and WHO have done, you could see another 500,000 deaths from HIV/AIDS. If you look at the analysis Stop TB and WHO have done, you could see another 500,000 deaths in the next year from TB. If you look at the work that's been done on malaria, you could see malaria deaths doubling. To put it another way, on TB and HIV, we could lose a decade's worth of gains. And on malaria, we could go back to the death rate of 2000. So 20 years of. Now, my view is that's just not an outcome that any of us are going to let happen. That's a pretty bad case. I'm determined and confident we can avoid that. The question is, how much can we mitigate the negative impact? And that's why the Global Fund moved very rapidly right at the beginning of March, making grant flexibilities available to countries. And then in April, with what we call the COVID-19 response mechanism. And as you say, in total, about $1 billion, although we've structured this in a way that can receive more money from outside, so we can channel further money into support to countries. And it's, when we say support to countries, it's adapting their HIV, TB, and malaria programs, because you can't run all these programs in quite the same way when you're going through lockdowns, when health workers are at risk and so on. Second, it is fixing doing urgent fixes to health systems. And I would highlight two things. One is lab systems, which are under huge pressure. And second is protecting health workers, because if you lose your health workers, everything in the health system begins to fall apart. And then third, it's some of the fundamentals of the COVID response, and particularly in the near term, diagnostics. You asked about sort of why and how the Global Fund was able to respond. Well, I think we have to remember that the Global Fund was actually created to fight the last big pandemic to hit humanity, HIV/AIDS. I mean, the Global Fund was actually designed to do this kind of thing. And so we have in place the infrastructure, the relationships, the ways of working with governments like Ethiopia, the ways of working with communities, the ways of working with the private sector that we have been able to leverage. And I think people underestimate how much the COVID-19 response in many countries is using and leveraging the infrastructure that has been put in place to fight the other diseases. So on testing, it's using the instruments used for viral load testing for HIV, or for case diagnosis for TB. But I would also say that while we have moved fast and we are working hard to support countries, we should all acknowledge that a hell of a lot more needs to be done. The scale of I think we're only at the relatively early stages of the pandemic in much of Africa. And we need to think in terms of this being the early stage of it. It will require more resources. It will require really determined action and leadership, and a huge amount of collaboration. Over.
Thank you, Peter. Certainly seen that agility firsthand. It really has been of huge help to countries. Certainly when commodities are scarce, there's limited access. I think the Global Fund has played a very important role in looking at equity amongst the commodities across, especially the African countries. Over to you, Dr. Tadesse. Ethiopia has also reacted very swiftly and boldly to the pandemic, launching a response that includes extensive screening, testing, contact tracing, and even the utilization of mass media campaigns to keep citizens informed. What was the key to Ethiopia's strong response, and how do you feel it has impacted the country's ability to maintain other healthcare services, especially with regard to the 3 diseases?
Thank you very much, Sherwin, and pleasure also to see you, Peter. It's wonderful to join this panel. Yes, as you said, Sherwin, Ethiopia activated the public health emergency response around the end of January in terms of activating the National Emergency Operating Center, and starting screening at all borders, air and land borders, and also preparing for cases in terms of facility preparedness.
No, I changed the setting, but I think we wouldn't have
other activities. I think
there's a setting in the Zoom.
Is there a sound coming in?
Hi, there's someone coming through. Okay. Please continue.
Okay, thank you. And as soon as especially the first case was also detected on March 13, before actually that, also in addition to the public health response, the multi-sectoral response was initiated by the Prime Minister by setting up a national ministerial committee that leads this intervention, and urgent and non-pharmaceutical interventions were also instituted quickly as soon as we detected the first case on March 13, like school closures and big gatherings were also banned, and in few weeks also additional state of emergency was announced to institute these NPI measures. And there was a strong collective response, not only within the different sectors in the government, but there was really a strong response from the community itself, taking a lot of role in terms of donating spaces for treatment centers, isolation, also supporting by finance and commodities. And there was also a lot of engagement of in terms of the risk communication work. We also used, of course, the Ethio Telecom to give messages with every ringtone, but in addition, a lot of engagement of artists, media people were also there in terms of the communication strategies, which was not just left for the government. And the professional also community came really together to support the task force, the EOC response in terms of getting several expertise. Then the different professional associations set up an advisory council that supported the response in many aspects to help us in evidence-based decision-making as well. But while we're doing this, of course, we are always revisiting our actions and our plans every 2 weeks to have an agile system also of response. While we're doing this, one of the things we noticed, I mean, the first February and March we were really intensively focused on the COVID response. But as soon as the first case was detected, we saw the following weeks a significant drop of outpatient visits, inpatient emergency visits in different in facilities all over the country, due to the, of course, fear from the community, as well as the shift of focus in the different facilities as well. So we had to quickly also adjust and make one of our biggest strategy in the response the continuity of essential services. So we developed a guideline to really prioritize what are the key essential services that can cause more harm in this pandemic if we quickly don't give a strong attention and follow-up. So RMNCH and HIV, TB, malaria, and few NCD services and trauma were prioritized, and we also instituted a strong coordination platform with the regional health bureaus, and ensuring that we send technical support and financial support to ensure that these services are not interrupted, but also communicating to the public that we are working hard to make the health facilities safe for them to come and get their treatment, because people were not coming due to fear of contracting COVID. So, but at the same time, also, of course, working on the health worker protection was another key issue, because although we designated some of our facilities to give full services only for COVID, and the others to continue the non-COVID services while they may have temporary isolation rooms for suspected cases that may come, still the supply of PPE has to be for all services. And that was also one of the challenges we faced in terms of really quickly availing for this large number of facilities for a big country. But that also was one of the areas where the solidarity had played a key role, where all the community had come in to donate, and also working with other countries and development partners to fill this gap. And while we work on these essential services, I think the other key issue was to look at what can we do to make sure people are coming to get their medicine. We tried phone follow-ups and ensuring that we have enough stocks to institute the multi-month also appointments and spacing to ensure for not just for HIV, but including tuberculosis, and also weekly follow-up of some of our data, rather than waiting for a month or so. But we are for even the non-COVID, the essential services, we look at malaria data, we look at patients who have missed appointments for who are on ARTs. So looking at this data weekly with the regional bureaus was also one factor that helped us also maintain. So in few weeks, we were able to see a shift again, that people were again coming to the facilities to get those services. So we integrated the COVID response with the non-COVID support as well. So I think this coordination, the agility of response, and really focusing on the continuity of essential services was, I think, one of the factors that helped us a lot. Thank you.
Thank you very much, Minister Tedesi. It's amazing to hear the proactive steps that have been taken and to see the results of how fruitful they've been and how they've limited the impact of COVID within the communities. Peter, it's pretty sobering to hear the impact and the possible extent that the three diseases could suffer from the impact of COVID. You know, losing a decade of gains is absolutely unimaginable right now, and certainly something we can't let happen. The Global Fund really was founded on a public-private partnership. And really to ask you, how important is the private sector's role right now, and the private sector's drive to drive impact in response to COVID-19? And how do we ensure that the Global Fund maximizes this partnership with the private sector against the COVID-19 fight?
As you say, the Global Fund was founded with a public-private concept at the heart of it. And certainly we have seen our private sector partners responding very quickly and constructively to the challenge of COVID-19, whether it's in helping adapt existing HIV, TB, and malaria programs, whether it's in very practical things like providing online communication tools, routers, and things like this to civil society groups and CCMs to enable them to shift rapidly to an online mode. Whether it's helping with get through some of the logistical challenges. I know Ethiopian Airlines, for example, has been helping with some of the medical product distribution across Africa. But we are going to need more, and we're going to need it in a sustained fashion, because we need the innovative capabilities of the private sector, because we need new tools. We don't have the diagnostics we need. We don't have the therapeutics we need. We don't have the vaccines. We need all of those things. Manufacturing things like PPE. There are shortages of PPE all over the world. It doesn't make sense to be shipping PPE all over the world. It's a great opportunity to be manufacturing, but it's got to be quality. We want health workers to be protected by appropriate quality. There are a lot of issues around logistics and supply chains where the private sector plays an absolutely vital role. The other side of it, as I mentioned, where we have shifted everything to a digital mode incredibly quickly. So TB consultations are happening online, you know, all sorts of things are happening. And a lot of the people involved neither have the kit, the technology, nor the experience. And the private sector is the best place from which to source that kind of expertise. But I also put out a little bit of a challenge to the private sector. And I know that the trouble with talking with this community on this call is I'm kind of preaching to the converted, because anybody who's kind of logged onto this, you know, already knows the logic of it. But we do have an issue, which is the private sector as a whole, the corporate sector as a whole, has underestimated what's at stake, what's at risk with infectious diseases. And if there was ever a lesson as to what's at stake and how it can screw up business and completely disrupt the economy, COVID has been a very, very powerful lesson. And I hope that when we come through this, we don't just kind of forget that, that we remember that actually there is a very powerful linkage between the health of a population and between the ability of a population to generate wealth through businesses, through trade, through economic activity. And that business has a lot at stake in making societies healthier. And in a way, my message to the people on this call, because I know they believe that, I know you all believe that anyway, is you've somehow got to be the people who convert the rest of the business community, because the business community as a whole doesn't really engage as much as it should do. And I'm always trying to work out how can we turn this from being just a crisis to being something that we can actually take advantage of. And this is one of the areas where I think we can change the relationship between the business community and health in a much broader fashion than we've achieved thus far.
Thanks so much, Peter. I think point noted. I think it's amazing that the impact that we've seen economically has absolutely been sudden due to the actions taken by government. But we should not forget that malaria, HIV, and TB have really been decimating our economies over the years, but in a sort of under the radar way, where it's not so immediate and the impact not so suddenly felt. But we do know that malaria has had a huge impact around communities, keeping them in poverty, impacting education of children. But we don't see the GDP impact in the same way as we have with the pandemic. And certainly, being part of the team, really working together with you on the board, as well as in our South African context, I think it's our duty to really showcase how the three diseases have impacted the economies over the year in a much more subtle sort of submersive way, rather than we've just seen the immediate reaction now with the pandemic. But certainly something.
If I can just add on that, Showan, I think you're absolutely right. And it's the classic thing where the thing you lose suddenly is very visible. The thing you've never had or that has been eroded slowly, you don't really notice. I mean, a very good example is there are many amazingly beautiful, interesting, exotic places in Africa that could have great tourism businesses, which would create a lot of employment and wealth for them. But because they have high burdens of malaria, it's extremely difficult to build a tourism business. When you do the math on that opportunity cost, it's a compelling business proposition to get rid of malaria. So I would completely agree with you that we need to make that clearer, because the burden we could take off the continent, not just by tackling COVID, but by getting rid of the other three diseases, enormous economic impact.
Absolutely. Thanks so much, Peter. Minister, the question I have is how has Ethiopia harnessed the power of its partners in this fight right now?
Thank you, Sherwin. Yes, as I mentioned earlier, I mean, the one of the key factors that helped us in this response is really the collaboration with different partners. I mean, it's clear definitely the role of development partners in terms of resource mobilization and allocation, as well as even shifting, reprogramming some of the fundings like the Global Fund and Gavi and others have done, and the World Bank allocating new money as well. So there has been a lot of support from the development partners, but also the business community has been also one of the strong partner in this response for Ethiopia. Beyond the corporate social responsibility that the private sector is doing in terms of this response through either financial or other in-kind donations and support. We have also been working closely with, for example, local manufacturers, existing ones, and also bringing in new ones to by also shifting some of their work into what's needed for COVID, like PPEs, sanitizers, and recently we're also under discussion to start test kit production as well, which is yet to happen, but already starting like PPEs and other local production to support not only the availing the supplies, is that of course the main priority, but also use it as an opportunity to support the local manufacturing capacity during this time. So we've been working closely with the industrial parks, Ministry of Industry and Trade, and the Ministry of Health to realize this, but at the same time, trying to make the regulatory processes much faster so that they can come into the business quickly, but of course maintaining the quality, as Peter mentioned. Beyond that, of course, we did create a forum with the private sector, a regular forum, especially with the private health sector, in terms of what are the areas of collaboration that we can do, leveraging the capacity of the private sector in this response. And one of the things we are now starting, of course, there are few facilities which started COVID treatment as COVID treatment, but now we have developed a clear protocol on how to start more, to engage more private sector facilities to give services as COVID treatment centers, because most of our facilities so far have been under the public sector who are giving direct service because we're giving the service for free, but they will start giving the service with affordable amount, but to also maintain the businesses, because this pandemic has brought a toll in the economy in different ways, and the private health sector has also suffered from that. So we need to collectively use it to help the response, at the same time maintain the economy and the sustainability of those services as well. And also in terms of lab testing as well. So engaging them in the lab testing. And of course, it may be specific for us, but health coverage of health workers' life insurance had been an issue, especially when in this kind of pandemic. So we have also worked closely with the insurance sector to also support the health workers' coverage, but also engage the private sector in this work. And there has been, the government has also done exemption of tax for those private sector engaged for directly COVID support. So that has also supported the private sector in maintaining that services. So there are, in terms of both direct COVID, but also maintaining essential services and local manufacturing, these are some of the things we have been trying to work with the private sector, but we do know that we still need to grow that engagement in terms of really having that strong public-private partnership that can support the health system while also gaining a lot of support from the private sector.
Thank you so much, Minister. It's so important that whilst getting local manufacture right, that we have the right regulatory environment to support it. And I think, as Peter highlighted as well, we do need local manufacture of high quality. If anything, the pandemic has shown us how our supply chains can be ravished by something like this, and how important it is to ensure strong supply chains within public health. Thank you very, very much.
You're mute, Sherwin.
Yeah, I just wanted to say thank you, Peter and Minister Tedesi, for your valuable insights. We now turn to the panel portion of the conversation, where we will hear from civil society as well as private sector partners on how they are responding to COVID-19 through innovation, scientific expertise, partnership, as well as local investments. Thank you very, very much, Peter and Minister Tedesi.
Sherwin, thank you so much for brilliant facilitation of conversation, as always. Peter, thank you so much for your participation. I know how busy you are these days, and I think the leadership that the Global Fund is demonstrating, and your leadership and your message to the private sector, given the many different perspectives that you have, is really important. Minister Tedesi, thank you so much for sharing openly what the government is doing and your openness to collaboration. It's great to hear about the collaboration that's happening within the different ministries so important, because we often hear about all of those silos, but also the collaboration that is starting to happen or more proactively happening between the different sectors, and working much more proactively with the private sector, and some of the things that you're doing to really facilitate their ability to, as you said, maintain essential services during this important time. I think as we open up the private sector session, and if I can ask my private sector panelists to start bringing themselves on screen and unmuting themselves, I think Peter has, very clearly articulated what's at stake for business in particular, but also just in general, and I think has thrown out some challenges for us in terms of how do we capture how do we build on the lessons that we've learned historically, and how do we build on the lessons that we are currently learning and create some sustainability here? How do we continue to bring others on board, because the small group that actually exists today, that, and in the grand scheme of things, it is relatively small. How do we continue to push that out there? And importantly, how do we continue to create the new tools that are so important, that number one will help us to continue to address and get some control over COVID, but how do we use this as an opportunity to continue to build our health systems and the resilience, and fill some of the gaps that currently exist. With that, I would like to introduce our private sector panelists, where, as Sherwin has said, we have an opportunity to hear directly about what civil society is doing, and a reality check of what's happening on the ground and what they're dealing with. And then from our private sector partners about how they're responding to HIV, TB, and malaria within the context of COVID, through innovation, scientific expertise, partnership, and investments. With me on the panel, I'll just quickly introduce everybody, is Olive Mumba, the Executive Director of the Eastern Africa National Networks of AIDS and Health Service Organizations, which is a regional network of civil society and community-based organizations working across 7 East African countries. Michael Steinberg, who is the team lead for global public health and special projects at Chevron, which many of you know is an American energy company working multinationally in many countries. He oversees programs that support the health needs of the company's 50,000 plus employees and the communities where they operate. Michael is also co-chair of our Corporate Alliance on Malaria in Africa. Paul Shaffer is the Executive Director of Global Health Policy at Merck, a global healthcare company, where he's responsible for global health policy issues in infectious disease, non-communicable disease, and reproductive health. Paul is also currently the alternate board member for the private sector on the Global Fund board. Obolonle Victor Lanyon is the head of sustainability at Axis Bank, which is a Nigerian multinational bank, or a Nigerian headquartered multinational bank, and co-chair of the Corporate Alliance on Malaria in Africa. She has over 20 years of experience in the field of sustainability and communication, spanning various industries, including manufacturing, media, and financial sector. And she's a 2-time recipient of the Most Outstanding Practitioner in Africa Award, so brings I think a very broad perspective of how domestic companies, how African-based companies are responding to health issues. Renuka Gade is the president of Global Health at BD, a healthcare safety and technologies company, and long partner also of GBCHealth. Renuka provides leadership for the company's global health initiatives, primarily focusing on emerging and developing countries. And within this role, she leads key public-private partnerships to improve access and strengthen health systems. And Elizabeth Madu Badang is Senior Vice President at Orange, Middle East and Africa, a global telecommunications company, and works to promote digital transformations that offer opportunities for socioeconomic development of emerging countries. Thank you all for being with us. Hopefully everybody has their video on now. Kicking off the private sector side and to set the stage, my first question is to you, Olive. I'm not seeing, can you turn, there you are, thank you. My first question is to you. In terms of helping to set the stage and acknowledging the critical role in this discussion, we would like to get your perspective on how COVID-19 is affecting HIV, TB, and malaria service delivery in Africa. And further, what innovations by civil society and communities have and need to be put in place to help cope with the changes and the challenges today?
Thank you so much, Nancy, and I'm happy to be on the panel. The organization I work for, IANASO, we are also the Anglophone Africa Community Rights and Gender platform hosted by, we host this on behalf of the Global Fund, meaning that what we want to do is to make sure that civil society and communities engage in every area that relates to the response. So quickly, what we did is we carried out a survey in 25 Anglophone African countries on what the issues are in relation to service delivery, HIV, TB, and malaria service delivery. And what we noted was various countries have various levels of lockdown, meaning that there are some that are in full lockdown where people cannot move, public transport is closed, yet there are some which are on partial, and there are some that are on moderate. Some can be only curfew, and in some countries you find people can literally do, life is as normal as it was before. So in terms of the biggest challenge that we noted was the first was access to health services. And we found that in the countries where there was partial to full lockdown, there was a challenge in accessing public transport, and as such, patients could not go to the health centers to be tested or to even get their medical refills. And this especially, we talk about people living with HIV and the TB patients as well. That also affected in terms of the caregivers. What we also see here in Africa is sometimes people do not get their medication at their nearest health center. Sometimes they have to go to a health center which may not necessarily be within the location where they live. And as such, they were barred from getting their treatment. Nutrition has also been an effect because most of the people, they work for the day, earn a living for that day. By the time they go back home, you have your food which you go cook for the family. And because of COVID, we found that there was a big barrier in terms of earning and in terms of accessing nutrition. And when we talk about nutrition, people who are on treatment require to be at least to eat something before they can take something. So that was also one of the barriers. We also noted that there was high levels of gender-based violence, people being in the same house, not being able to go out. So we found that the amounts of rape increased, but also the numbers of teenage pregnancies or adolescent girls and young women pregnancies have also increased. And we know that gender-based violence fuels HIV, and even in terms of TB, access to TB health services. We also saw an increase in terms of violation in human rights, especially around the LGBTQI community, because not most, but some live in hostel type of accommodation. And that has an effect in terms of where there was a full lockdown. Hello, can you hear me?
Yes, we can hear you.
Okay, what I'll do is I'll remove the video because I think my network is a bit unstable, so for people to hear me. Yeah, so quickly, there was also lack of credible information at the beginning of COVID around February, March, because everyone was sending information and most of it was false. We also noted that. There was also, in terms of the supply chain disruptions, access to getting medication and equipment to people within the various localities was quite a difficult thing. But all in all, it was a hard time for civil society and communities to engage because they too were locked up and couldn't move. But also there was an increase in terms of stigma and discrimination. So as time came, we knew that as civil society, we cannot close ourselves indoors, but we need to do something. So with that, we saw that a lot of communities and civil society we organized ourselves, and then we also, as the Minister of Health mentioned, brought together some money, some pockets of funding, and we went to distribute food and even distribute or pick up medication and drop the ARVs and food packages to our communities that we knew had issues or couldn't access health services. The other thing that we have done currently is from my organization, together with other partners, we've developed an app. It's a mobile digital app that tracks in terms of community infections of COVID. This app is ready to be used. However, what we would want, and I think this is my opportunity to also reach out to any colleague here, that if you could support us to really implement it in some of the countries. It's an app that as civil society, it's a community-based monitoring app where we want to see where the new infections are, because we currently, in most of our countries, we still do not have that ability. And we know that in the next couple of months, COVID is going to, the infections are going to become more and more. The other thing that we have been able to do is we are using the current WhatsApp groups or these other digital apps to be able to discuss issues around COVID, gather information. We've seen colleagues having hotlines where if there's any challenge, they're also able to utilize that. I would like to take an opportunity to thank the Global Fund for the work that they are doing. Thank you so much, Peter, and the team in the Global Fund for all that you're doing for us, communities within the developing countries. First of all, because of the COVID-19 response mechanism that you've come up with, and even in terms of the flexibility funding. With that, I would want to come back to you, Nancy. Thank you so much.
Thank you so much, Olive. And it's really interesting to hear again from a different perspective the importance of digital and how you're addressing some of the issues of movement during lockdown, but also in terms of monitoring communications and aligning different distribution systems to address a couple of different issues. Mike, I'd love to turn to you and talk about how COVID-19 is impacting the ability of Chevron to run its operations and programs on the ground. Certainly, Chevron has a long history of investing in the communicable diseases treatment prevention, and in terms of investment in health systems strengthening. What are you doing? What's your company doing? How are you addressing COVID and the diseases?
Okay, thanks, Nancy. Can you hear me okay?
Yes.
All right. So yeah, first, thanks for having me, and certainly to the other speakers and participants. And thank everybody else on the line as well for the work that they do, and ultimately, hopefully, saving lives. This is what we're really focused on. So I think we have to remember that there's a life behind every statistic and every story and every metric, and just not lose sight of that. So we've done a lot with the COVID response. I'll focus a little bit more on our health and our medical operations. So we've been certainly all the more focused on maintaining the health and safety of our workforce, and then obviously minimizing the impact of health threats to our critical processes and operations. So with regard to impacting our ability to run programs on the ground, again, I think we know we must not forget there are these other health threats, and now they're at much greater risk. So I'm happy to see that every day I see a new article, a new publication, something around talking about existing health threats of HIV, TB, malaria, and the impacts that are going to happen that are happening with kind of taking a step back with those. And so I'm glad there's a lot of growing visibility around that. I mean, we know mosquitoes are still flying and babies are being born and vaccines are still needed, and we need to get those out to people. So we've, like many, we've redirected our efforts and we've right-sized those to address the gaps kind of throughout the response life cycle. So we've a strong focus on ensuring the continuity of our core medical necessities. So we've really increased our medical resources and services up since January, February time. We've increased our doctors, our nurses, our supplies, our medications, our personal protective equipment. So initially, I think the thought around this, probably rolling into January, February timeframe, that we look at a 6 to 12 month disruption period. Clearly, we know we're in this for a long time. We've also been addressing our highest risk populations as well as those that are most vulnerable, like immunocompromised. So we've incorporated and really scaled up our telehealth and virtual services, our home medication deliveries, flexible work schedules, modified individual assessments and screenings. And then we've worked on risk stratifying our workforce so we can better help protect them. And we've certainly got a lot of processes in place at all of our worksite locations to confidentially address anyone that has concerns, returning to work, and people that might be at higher risk. So in Nigeria, for example, our medical providers, they've been able to maintain our TB, malaria, and HIV services. They've increased their home visits, and they've worked to simplify the medication refill ordering process. In our Asia-Pac region, for an example, they've really scaled up our medical resources to support the workforce healthcare needs. And then communities, we've partnered with NGOs to provide supplies, both for COVID-19, but also to bring awareness materials around other communicable diseases and safeguards. We've increased a lot of visibility around our services and communications around key opportunities such as employee assistance and work-life services and mental health services. And just one note on communications, and it was nice to hear Olive kind of say something about, we need to make sure we've got, people are receiving accurate information and the right information. So, I just think the communications are still just so critical on many levels. They've got to be right-sized, they've got to be culturally appropriate, they've got to be evidence-based, and I think across multiple channels. We've got a corporate pandemic response team that's done, and that's a whole nother a few hours of talking, but we've really been scaling up our testing and our tracing, surveillance, technology, safeguard protocols, and all the expectations for the workforce. So how are we using experience? And we've got a lot of experience, as Nancy said, in investing in health systems. So, we think each entity has a role in addressing health threats, and we feel it's our responsibility, certainly as a corporate citizen, as a neighbor in the communities we operate in, and we do have a long history and experience and processes in place for supporting outbreak responses and health system strengthening. And I just want a quick note, and Peter mentioned a little bit, and Olive, I think, in Ethiopia, we talked about partnerships. So they're absolutely critical. And we're proud to support and partner with a lot of partners. Certainly, for example, the Global Fund and Friends of the Global Fight, who lead their critical catalytic and advocacy work. GBCHealth and CAMA, who've connected us all here today, which thank you for that. You guys play a critical role in global health security and supporting community-based organizations on so many levels. So the partnerships are certainly critical. So again, we've been addressing issues and needs across the response life cycle. So there's the initial reaction mode, and then we're really got to look at that long-term planning and sustainability. So first, of course, addressing the health and safety of our workforce, and then supporting the local communities where our workforce lives and works and our neighbors live. So in a variety of ways. So just a couple of examples, we began, it was certainly provide financial support in a lot of different ways. And I'm not going to mention the numbers and all that we've done in that, but we've been providing medical supplies and food and transportation, personal protective equipment and fuel, to help people get better access. In Kazakhstan, as an example, we invested in providing some critical medical supplies. We're supporting some partners that are building a new hospital, which will be something that, that's a long-term opportunities there. In Nigeria, we donated some support to local response efforts and equipment, and then we donated some buses to the Lagos State Ministry of Health so they can use those for contact tracing and logistics. One of our U.S. locations, we utilized some of the technical expertise and resources So our teams learned how to print 3D medical face shields for some of the local hospitals. And then in France, there was a real shortage of hand sanitizer for a while. So one of our production plants modified part of the plant to produce hand sanitizer for the French authorities with a recipe provided by WHO. So with sustainability and, and this long-term value in mind, a lot of the work we've done in the past certainly benefits us today in building capacity and infrastructure. And I think Peter kind of mentioned that too. They've done so much, and we've got these mechanisms in place to leverage now. So a couple of examples. In Angola, early on we shipped some personal protective equipment and ventilators to our Angola medical teams. And then for a long-term response, one of our U.S. doctors has been assigned to supporting a collaborative project building a new intensive care facility there. We've scaled up our virtual intensive care support with our U.S. medical teams to address kind of building local capacity and addressing local needs. And it's not just throwing money at things. That's part of it, of course. We all need more money, but that's not effective unless you include the capacity building and the training. You optimize the access and enhance the transportation and infrastructure. So this continues to be a big focus of ours. I think, and I think Peter mentioned that, I think supply chain issues are going to continue to be one of the major issues in ensuring people are getting the medical supplies and medications they need. So I encourage, we as well, we've got a lot of experience in that area. I really encourage us all to work together to implement solutions. So I'll stop there. I mean, there's plenty more to share, and anyone can certainly reach out to me after this session. Thanks, Nancy.
Thank you so very much. And I think, what you've done is you've created kind of a roadmap or a little bit of a vision of what a company can do where health is, what you've demonstrated is the importance of health to your workers, et cetera. And even though you're not a healthcare company, how you've been able to invest and ensure that health is part of your agenda and how you're working to support your employees and communities. Paul, I'd love to shift a little bit to you as a healthcare or health-related company and drill down a little bit more in terms of some of the diseases. Merck in general, you're working across a number of the different sectors, from HIV to non-communicable diseases to sexual and reproductive health, but you've played a really important role in the HIV/AIDS space. So can you share with us a little bit about how the company is using some of the lessons from the fight against HIV to respond to COVID-19, and how you're ensuring that the supply of the medicines and vaccines, et cetera, is maintained during this crisis period?
Sure. Thanks, Nancy. Thanks for having me on the panel. Like with HIV, I think with COVID, we are seeing governments, healthcare workers, and specifically with COVID, other essential workers, civil society, everyday citizens, and the private sector really doing their part in this truly global effort. And that includes the biopharmaceutical industry. And as a company dedicated to saving and improving lives, Merck, or as we're known outside of the US, MSD, we recognize that we really have a special role to play in this response. There are really 4 areas that we've focused on. Obviously, protecting the safety and health of our employees and their families is critical. Ensuring that our medicines and vaccines reach our patients and customers. And looking forward, contributing our scientific expertise to the development of new medicines, antivirals, and new vaccines, and also supporting healthcare providers and the communities in which we work. As a company, we know that from our experience in HIV and also in Ebola, that science and collaboration are both essential, both to develop the medicines and vaccines in a public health emergency like this one, but also, and perhaps almost more importantly, to getting these medicines and vaccines to those that can benefit from them. At Merck, we're exploring several different pathways to bring new COVID vaccines through development. And we're also looking at the development of a novel antiviral candidate. For the vaccines, we're working with the International AIDS Vaccine Initiative, or IAVI, to use the Ebola vaccine platform that was recently deployed in the Congo to help bring that Ebola outbreak under control. As a platform for a COVID vaccine, we're also looking at a measles virus backbone. So we have two different technologies that we're looking to advance for a COVID vaccine. And we have also entered into a collaboration with Ridgeback Biopharmaceuticals to develop an oral antiviral candidate, which is currently in early stage clinical development. Obviously collaboration is key, and we're working across multi-sectoral efforts to better understand the virus, to advance vaccine and treatment development, including working with the US NIH Active Consortium, with the Bill and Melinda Gates Foundation. We are optimistic that the biopharmaceutical industry's efforts will create new tools to combat this coronavirus. And this pandemic underscores the need for our company and for the industry to continue to invest in research for greatest public health threats. I noted what Peter said about looking at not just COVID, but the next pandemic. And I think one area that has been brought clearly to the fore that we knew about before, but COVID reinforces, is really the need for us all to look at addressing antimicrobial resistance more broadly. We see the great need for use of antimicrobials for treating the aspects of COVID. And I would say that this is one area that, for those who are listening, I think it's an area that not just from the private sector perspective, but for governments and across the multi-sectoral response, we need to continue to look at how we can address the issues of antimicrobial resistance and the development of new antibiotics and antifungals. But it also highlights the need for a multi-sectoral response to address the funding, the health systems, and the implementation challenges that will be really critical to making these scientific advances available and to deliver their benefits to society and to people globally. So at Merck, we're committed to working with partners globally so that our products are accessible and affordable to governments and health systems globally. I won't go into it in detail, but we're also supporting patients, healthcare providers, and communities through a range of relief efforts. And Merck has contributed more than $30 million thus far to COVID relief efforts. We've also worked to ensure continued access to our medicines throughout the pandemic to meet the increased demand for some of our medicines when governments have recommended patients to increase the supply of those medicines that they have on hand at home, and the significant increase in demand that we saw in some key ICU products and antibiotics that are used directly in the treatment of those with COVID-19. We'll continue to work to ensure access to these products as we see a shift in the burden of COVID from Europe to Latin America and other areas in the developing world. As we work to advance development of our new treatments and vaccines, we will look to work with partners and stakeholders globally to make these products available. I think one thing that we've learned from HIV is that no company and no sector can do this alone. And to be successful at bringing breakthrough innovations to those that need them globally, we will need a multi-sector response with funding from governments and donors. Thanks, Nancy, and I'll look forward to the Q&A.
Thank you so much, Paul. You gave me a little more hope. You gave me a little bit more optimism than I've had recently in terms of thinking about some of the investments and some of the reporting back on the work that that Merck is doing and some of the evolution and repurposing. I think the message of collaboration and multi-sectoral approach and being aware of not just focusing on this, but looking at what else is the other diseases that are that we're still dealing with, but importantly, preparing us for, you know, kind of whatever that next wave is that we don't know what we don't know yet, right? I think all of those are really important, and love to talk a little bit more as we get into the Q&A also about how you're balancing kind of that investment and the innovation in the new, and ensuring that that you maintain the access to those critical medications that are so important to addressing the diseases. Thank you. Belanli, Axis Bank, a financial institution, you've had a very long history of commitments to fight HIV, AIDS, and malaria, and more recently, you've quickly reacted with support to the Coalition Against COVID, which is really a private sector-led initiative in Nigeria in partnership with the government and multilateral partners to combat COVID-19. How were you able to mobilize your response in such a short period of time, and how are you working to continue to maintain your focus and your investments around HIV and the malaria programs in the midst of this pandemic?
Thank you, Nancy. Hello, everyone. It's evening here in Nigeria, and I'm conscious that we're all in different locations. Thank you very much. I think that, first of all, I would start with the COVID partnership, which is the Coalition Against COVID, and then I'll talk about our ongoing commitment to HIV and malaria. First of all, I'd like us to note that, over the years, our sustainability agenda has been focused on us, identifying societal challenges, working with partners to provide innovative solutions to address them. So it wasn't surprising to note that our immediate efforts to address COVID-19, which of course included the co-creation of the Coalition Against COVID, was just for us a very natural response. And I mean, at Access Bank, we consider partnerships and collaborations as being at the very center of achieving the Sustainable Development Goals, particularly in Nigeria, where, we have a lot of critical health issues and we have a lot of gaps that exist. We've observed over the years that partnerships are important for us to be able to scale up resources, for us to achieve our intended project outcomes, for us to accelerate our collective progress and make greater impact. So CACOVID was formed with like-minded organizations that have similar values with the bank. So we already have established relationships over the years, relationships that result in positive impact, of course. And so it was easy, for instance, to work with the likes of the Aliko Dangote Foundation to, co-create CACOVID and to, lead the efforts around the private sector support in response to COVID-19. I mean, again, talking about partnerships, if you take the example of the Aliko Dangote Foundation, we together already work on various initiatives like the Nigerian Business Coalition Against AIDS, Corporate Alliance for Malaria in Africa, Global Business Coalition on Health, GBCHealth, amongst others. So it was, I think it was just natural and it was easy to align because we have similar values. And it was also easy for us to leverage the influences of both organizations to bring on board other private sector partners and to also, of course, partner with government agencies as required. So whilst the importance of private sector intervention in the COVID response cannot be overstated, the health pandemic also brings to fore the essence of public-private partnerships. And we are aware that clearly the private sector cannot on its own achieve success in these interventions. So we, of course, have to work with relevant government institutions and agencies. We have today, as one of the speakers, Zoera Yusufu, who is the CEO of Aliko Dangote Foundation, and who leads the efforts of COVID at the secretariat level and at the steering committee level. So again, our experience over the years has provided us with all of the right relationships that we required for the success of COVID. Also, very importantly, because this aligns with SDG 5 on good health and well-being, and is a priority focus area for our CSR interventions, it was easier to get the relevant buy-in for such huge resource commitment to addressing the pandemic. So in view of COVID-19 and the consciousness that the government required private sector support, especially in a country like Nigeria, it was important for us as a private sector to rise up to the challenge, to take the necessary action, leverage our resources, leverage our expertise, and really support Nigeria's response to COVID-19. Now, coming back to HIV and malaria.
Hello?
Yeah, coming back to HIV and malaria, as you've asked, I mean, so despite the disruption that COVID-19 pandemic has caused globally, malaria and HIV for us remains significant public health challenges, with African countries bearing high burdens. In fact, in Nigeria today, malaria is the leading cause of illness and mortality. So if we look at, I mean, the data that exists, the WHO data in 2018 with 228 million cases of malaria and 405,000 deaths worldwide, 93% of these cases and 94% of the deaths are in Africa region. Now, Access Bank is an indigenous multinational organization, in African indigenous multinational organization. And therefore, we also need to continually stand up to address the challenges that are facing our countries of operations. So if we look at that same data from WHO, we see that 6 countries, including Nigeria and DR Congo, where Access Bank has presence, accounted for half of all the malaria cases worldwide. Now, Nigeria alone accounted for almost 25% of the cases. So that, of course, tells us that we can't fold our arms and not do anything about it. We can't afford to ignore malaria, okay? And if we move to the side of HIV, I mean, I had to look a bit more around data, and as at 2019, we had about 38 million people living with HIV globally, with about 1.7 new infections and 690,000 deaths from AIDS-related causes. So as a result of COVID-19, UNAIDS also reports that there is a disruption in HIV treatment, and that could lead to additional 500,000 deaths from AIDS-related diseases. So if we compare that with the cases in Africa for COVID-19, we had, you know, just 492,000 cases and over 8,000 deaths. And Nigeria, we've had 744 deaths. So from COVID-19, so it's clear that malaria is very important. It's killing a whole lot more people. COVID-19 is important for us to invest our resources in, but we cannot ignore malaria. We cannot ignore HIV. So for me, it's a case of we cannot afford to rob Peter to pay Paul. We need to address all of the issues, and we cannot afford to stop or reduce our commitment and attention to malaria and HIV in view of COVID-19. So amidst this COVID-19 period, whilst all of the efforts around COVID were ongoing, as an organization, we also had to attend to various groups of vulnerable people with respect to COVID-19, be it the physically challenged and communities of people living with HIV, AIDS, widows, elder citizens, and those that are really at high risk of COVID-19. But we didn't ignore malaria. So in partnership again with the Corporate Alliance on Malaria in Africa, we had to implement malaria programs around 3 key states in Nigeria. In the Southwest, was easier to do that because of the restrictions in movement. So we implemented, malaria programs with CAMA in Lagos, Ogun, and Oyo states to commemorate the 2020 World Malaria Day, in addition to quite a number of other programs. And this, again, was for us sending a strong signal that we are not ignoring or reducing our commitment to malaria or to HIV in any way. So the programs focused on one hand on advocacy of malaria prevention and treatment, which is a key issue in Nigeria because many people are just too familiar with malaria and it still kills, a lot of people. And of course, advocacy on one hand, but again, treatment, especially targeted at pregnant women and children, where you have high mortality rates, even during the pandemic. So we were able to reach on this program over 5,000 people. We also distributed 1,600 long-lasting insecticidal treated nets, also considering that, the situation in terms of the outreach required social distancing, all the protocols being fully respected. That impacted on the number of people, we could reach and do the one-on-one on, but we still, made quite some efforts. Additionally, we worked with the primary health centers in those communities. We also gave them, the nets so that people that are in the community and use those healthcare centers would be able to have access to the additional nets and provide the necessary hygiene, which we think is also beneficial in helping them to prevent any form of disease. Now, also,
Balanli, sorry. In the interest of time, you have so much to share. But in the interest of time, if we can hold some of this to come back for the Q&A. And I think, what you have shared with us and demonstrated is, one size does not fit all, that there are very different situations in different parts of the world. That, you've clearly demonstrated the importance of keeping investments and progress on the diseases that in Nigeria certainly are resulting in a much higher death rate at the moment than COVID is, but also I think really being aware of the interconnectivity and the importance of also paying attention to COVID, both from a national perspective, but also, as that interconnectivity with different countries in Africa and around the world. So thank you for that, and hopefully we'll have a little bit of time to come back and probe a little bit more, and particularly why, a bank has invested so much in health.
Thank you, Nancy.
Renuka, BD. Such an important role in the development of critical diagnostics, historically around TB and others, big investments in leadership around AMR and a number of other key health issues, and now diagnostics around COVID-19. Can you share with us how BD is deploying its capabilities and expertise and scale to address some of the critical health issues related to COVID, and especially in the low to middle income countries? You're on mute. You have to unmute, Renuka.
Sorry about that. So
thank you.
Gain some time. Thank you, Nancy. So how are we moving forward and fast when the world seems to be at a standstill because of the pandemic? I'll try and give you a flavor, but first, BD is a 123-year-old medical technology company with global operations and global presence. And so this pandemic clearly created chaos in ways that we would not have imagined. On one hand, trying to keep the steady state going while also bringing in new tests and new diagnostics that are much needed. So I'll try and frame my responses into two buckets, partnerships as well as innovation, to address your question. On partnerships, we've had long-standing partnerships with CDC, PEPFAR, and USAID on HIV and TB. And given this lockdown and pandemic, clearly the programs are impacted. We've heard those statistics already, so I'm not going to repeat them. But as a response, what we've been doing is trying to create more and more online resources for mentoring and training through an extended platform in collaboration with the University of Michigan. We've partnered with DevX to shine the light on the advanced HIV disease Know Your Count, which is so important in the context of the advanced HIV disease being the lead cause of HIV deaths. That includes, of course, TB. We've been doing unique ways of installing diagnostic equipment to address AMR. For example, in Timor-Leste, the country was getting its first automated IDAST diagnostic platforms, and the installation of this huge equipment happened all through remote technology, through our Lightning module. So very new and innovative ways of addressing partnerships on one hand, trying to also leverage our core competencies, for example, with the government of India in the Northeast, where it's really hard to get sputum specimens transported to the central TB labs. We kind of deployed our supply chain systems to see if we can make that specimen and courier capabilities happen. So that's kind of at the partnership level. On the innovation level, as soon as COVID-19 struck, we developed a COVID-19 assay on our BD molecular platform, which is the BD Max system. Now, BD Max has a footprint more in the developed world than low middle income countries. So clearly what we saw was even in the developed world, demand outpacing supply. We had to especially expand a line to cater to the demand of simply even the developed world. So as we speak, we're now looking at what can we do to scale those molecular platforms for the low middle income countries. And especially this is the platform that can also run an INH and RIF-TB resistant module. So there's active discussion with CHI, with agencies such as FIND and WHO to see what can be done to introduce this. But I'm really excited about a technology that we launched last week, which is a rapid antigen test, the test that the world's waiting for in a way, because you can get your result in 15 minutes. This is on a point of care platform, almost I'd say the size of your iPhone that can fit on your palm, and you get your results in 15 minutes. Now, we're in discussion again with governments, whether that's in the developed world or with the Bill and Melinda Gates Foundation, Africa CDC, and FIND, to say, what do we need to do to scale this much needed technology and test to LMICs, whether that point of care instrument is also a bit much, and whether we want just a visual read test. So we are in that. So thankfully we have this test which has tremendous performance, 100% susceptibility and an 85% sensitivity, which is really, we're very thrilled about this. So we're looking at ways to scale this, ways to make it connected, so that we can collectively solve the problem. And I'll just close by actually quoting Paul's comments. You know, this is the time where science and collaboration need to happen. They need to come together. Business, science, core competencies, collective partnerships, because COVID-19 has exposed in more than one ways the weaknesses in a more developed country health system setting, and it's also at the same time burdened already fragile health systems in the developing world. So it really forces a global response, and the best way to deal with a global response in an era where you can't really say nationalization in my country first versus yours is through collective collaboration, so that everyone gets access no matter where you're born. And that's kind of the next discussions that we're having with our tests, as well as trying to kind of keep the partnerships and focus on HIV and TB as active as we can during this lockdown. So thank you, Nancy, and I'll pause here.
Thank you so much for Renuka, and thank you for kind of ending on that note of access and equity, which is so important and so relevant across a broad range of discussions, and really very promising new technologies that you've shared. So that's very exciting. Thank you, Elizabeth. Over to you. Last but certainly not least. Orange is leveraging its expertise and technology to develop digital platforms to improve access to health services and build stronger health data systems in Africa. And certainly that technology is part of what links so much of what we've been talking about today, and the ability to manage, to monitor, etc. How is your company using its expertise to tackle COVID-19? And why have you as a company chosen to really invest in this, in the health space in general? Elizabeth, you're on mute.
Okay, okay.
Hi.
Hi, thank you, Nancy, and good day to everyone. I'm very happy to take part in this panel discussion during a very sensitive period as regard to health and with this COVID-19 pandemic. Maybe a few words to start with about Orange, as you said. Today we operate in about 27 countries for our retail business. 18 of those are in Africa and the Middle East. Our role is evolving from a connectivity provider to a multi-service operator. We leverage on our assets, such as our network, our distribution presence, our data analytic capabilities to improve quality and access of essential services. Among those services, we have as a priority health services, but alongside with other services such as education or financial services. Our goal is to position ourselves as a leading partner in the state and ecosystem of the African digital transformation. Our approach is based on building relevant partnerships. Paul mentioned it earlier on, Raluca as well. But really, this is an approach that we want to take, to have partnership with public, private stakeholders, such as yourself, Global Fund. And we are very proud of this partnership, and we expect it to grow in other countries. We work today in Morocco and Cote d'Ivoire, but I hope that we will expand it in all our geographies because the needs are there. Our intervention can be structured in three main areas. The first area, and the services that we build are designed accordingly. The first area is around services for health professionals or authorities. So you have services like data collection, data hosting, data securization, epidemiologic service. Another set of services is related to patients. And then you have remote monitoring, you have diagnosis, telediagnosis, and things like that. And the third category is related to prevention and wellness. In this set of services, you have health information sharing as an example. Our approach is designed to build tailor-made solutions. focusing on a user-driven model. So instead of asking our partner or our customer, what product do you want? We would ask, what problem do you want to solve, so that we make sure to be as relevant as possible and to meet the partner and or the customer requirement. So just to share a few examples, we are currently developing an innovative mHealth platform to ensure the broader access to healthcare services that can be used to follow patients remotely while providing healthcare to workers with all the information they need, and to make the right decision and offer and improve the quality of the healthcare they provide to patients. Now with the COVID, we have adapted, we have included some features. Previously, it was mainly focusing on HIV and TB, malaria. Now we added some specific features, some information related to social distancing and all the protective measures on this platform. As we speak, we are about to roll out this platform in partnership with Global Fund in Côte d'Ivoire. And in Côte d'Ivoire, there will be few features. One of the features will be patient medical file creation and management. So it will be easy to register patients and to follow the life cycle, if I may say so, of the patients. There is a reminder feature, reminders for appointment and for prescription. There is everything related to patient awareness, feedbacks through surveys, and follow-up and monitoring. There is a feature related to statistic and KPI to support medical decisions, and also patient mobility tracing. So those are some of the features that we will find in this solution. We expect about 50 million notification to be sent to patients per year with this solution. Coming back to what we did during the COVID, during this crisis that is still on. In almost all our footprint, we have used our technology to support the authorities. One aspect was in their communication on all the protective measures. We use short messages, but even some very unusual services were used, such as the ringback tones that we have used. Every time a customer would place a call, they will hear some messages, some instruction from the Ministry of Health. In Senegal, as an example, we have used anonymized data to help the government control the effectiveness of the confinement measures. Outside the MEA region, we have launched a service called MemoQuest COVID-19, which allows in an automated way to monitor patients remotely using chatbot and short messages. Those are the innovation that we have created ourselves. But sometimes, and one of the panelists mentioned it earlier on, sometimes we support local startups as well. During the COVID-19, we did that in several countries, such as Senegal, Côte d'Ivoire, Tunisia, and Burkina Faso. And the solution that they have created were around auto-diagnosis in order to reduce the number of people going to see the doctors. So this is a solution that was created in Côte d'Ivoire as an example, and Burkina Faso. In Tunisia, they have developed a robot in order to prevent the virus expansion, the contamination between patients and doctors, or patients and their family. So through this robot, the patient could remain connected to their family even when they are hospitalized. So these are some of the examples of the solution that we have developed and we will continue to develop. As someone mentioned earlier on, the importance of the technology is more critical than ever. With diseases such as COVID-19 and the pandemic as this one, the burdens rise, and the other diseases are still there. The HIV, TB, and malaria, they are still there. So it's putting even more pressure on the health system. So it's underscoring the need to accelerate the deployment, the rollout of all the current solution, and all the new innovation that we can find. The main challenge here is to scale it, is to have more and more health centers connected or using this kind of services. And this is where partners like Global Fund have a critical role to play. I know you are already doing it, but the needs are so huge that we still request, we need your support to expand the use of this kind of solution, because we think today that technology is so powerful that it can have in a very effective manner can be used for predicting new diseases, for preventing them, and controlling the emergence of infections such as the COVID-19. We have a lot today. We can use the data analytic capabilities. We can use the IA. There is a lot that we can do today with the technology and the penetration of mobile, which is wider and wider. That's what I wanted to share with you. Thank you.
Thank you so much, Elizabeth. And I think this is a great place to transition for a few questions. I know that we're running a little bit late. Hopefully everybody can stay with us a little bit longer, but ending on that comment around partnership and innovation and connectivity, and thinking about how we can scale and adapt different kinds of functions, and the role of technology in all of this. With this, let me turn over to Ochuko for a few short questions, and then our final comments from Zuera.
Thank you, Nancy, and thanks to all our amazing speakers for the insights and expertise you shared so far on this important discussion. And thanks to all our participants for sticking with us. And though we're running a bit late, we will ensure that we wrap up as soon as possible. My name is Ochuko Keyamo Onyige. I'm the country manager for GBCHealth CAMA Nigeria. And it's my pleasure to be handling this session. So the first questions, we will actually address some of the questions that have been put across, ensuring that we finish as soon as possible. The first question goes to Mike from Shaffer. We've talked about some of the challenges posed by COVID so far, and I believe that in every crisis there is an opportunity. One of the opportunities that is as presented is how the health issue has been elevated on a very large scale. So how do we use this opportunity right now to rethink and reframe how we fight these three diseases in addition to others and COVID? And what are some of these suggested solutions to addressing some of these global health challenges moving forward? Over to you, Mike. Please, let's stick to, make it short and succinct, yes, so we can wrap up and leave as soon as possible. Thank you.
Yeah, I'll try to just keep it real quick. I mean, I think that the partnerships are key, as we talked about that again. We've got the infrastructure in place. We've got the partners in place. I think we need to make sure that we're all at the table having those conversations, including, everyone that has a role in combating, health threats like COVID-19 and future health threats. We've got a lot of the infrastructure. We know it needs to be further developed there. We know about supply chain needs. We know, we've got solutions to some things, and we still struggle today with the health threats for the past 30, 40 years of getting the right materials, getting the right resources, getting the right training to the right people. So I think, we need to continue to just get everybody at the table, look at having transparent and honest conversations, look at short, mid, and long-term solutions, measurements, get around aligned goals, and have, again, the honest dialogue about some of the challenges with distrust and the suspiciousness and competing priorities. So I think that's one critical piece of it. I'm sure others can add on to that quite a bit. Again, I'll try to keep it short.
Yeah. Thank you. So I will still throw the same question to Bonle from Access Bank. In addition to COVID elevating health on a very large scale, we begin to see that some decision makers are beginning to realize that global health problems are also economic problems. And when we have global health successes, we have economic successes. How do we maximize this opportunity that we have right now to step up investments? As a bank, I know you've been doing a lot in terms of investments. How do we ensure that we step up investments and foster more partnerships, considering what we're going through right now? Over to you, Bonle.
Okay, thank you, Ochiko. And I think that that's a very simple thing. It's straightforward. Stepping up investments in private sector requires you to make a business case. And the business case is simple. Where the health is challenged and people are not able to work, your productivity dwindles. And where health is challenged and your customers are not able to either purchase your products or your services, your customer base also dwindles. Therefore, profit dwindles. So is the investment case, right, for any organization to invest in health can be as simple and straightforward as what, I've mentioned. And I think that we found a situation now wherein we've also realized, and many private sector organizations have realized, that rather than going alone, when you go on the journey of your health investments with other private sector organizations, right, or you partner with organizations, the cost to you as your own organization is reduced because you don't need as much resources in terms of maybe financial resources. You could also, contribute your skills and your expertise, right? So you partner with an organization that is into logistics. So you take the expertise of that to get your commodities to, communities. So partnerships, again, tend to overall help to reduce cost to each individual organization. And I think that that on its own makes a case for organizations to focus on the health. Where society is not healthy, there's no business. Thank you.
Thank you for that. And then I'll move on to Paul. Can you talked about some challenges in terms of continuing providing access to some of the commodities that you're currently producing. What actions do you think countries and businesses can take to ensure that we have continuity of services, to ensure that the end users have access to these commodities?
I think what we've seen throughout the course of the pandemic is, as governments and health systems get challenged, their ability to deliver care to people that have a range of different illnesses, whether it's people initiating cancer treatment, whether it's people accessing routine vaccinations, whether it's people accessing just regular wellness visits or just procedures, really suffers. And I think what the value then of bringing these new innovative products to market, whether it's treatments for COVID, whether it is vaccines for COVID, will be to allow people to go back to the essential regular medical care and preventative care that they were getting. I think from a Merck perspective, we worked hard to make sure that our manufacturing has not been interrupted, that we can deliver the medicines to people that need them so that they can maintain their treatment, so that we can respond to the surge in need for certain ICU products to address the epidemic specifically. But I think the key is going to be that as we bring these products to licensure and to fruition, that governments and donors have come together to create mechanisms so that these products can be accessed by people globally, and so that we don't have one country or a couple of countries really foreclosing the supply, and so that global mechanisms are put in place to allocate them to people that need them across the globe.
Thank you very much for that. And I have a quick question for Olive, from the civil society organization. We've been talking about building back and going back and ensuring that we get back to normal if possible. And community, I know you work a lot with communities, and working with the communities also tied with the health system and all of the work that you do. How can the health system maintain? Because obviously, if we have better health system, we will be able to manage current health challenges and also manage future pandemics. And you've talked about data and talked about supply chain and a lot of things that is all that you're facing on the ground. How do we ensure that we maintain a good health system and prepare for new challenges in the future? What do we need to do to prepare? Just give us quick responses, few steps that you think we can take to ensure that we get there. Thank you.
Thank you so much. On my side, one is giving space to civil society and communities to be part of the response. And this means that wherever the seats are, let civil society and communities be part of the response, so we can build the community systems as we are building the health systems. Secondly, is to invest in domestic resources. We cannot continue to rely on funding from other countries. We need to rely on internal resources. Third, policies and programs that respond to community systems strengthening, human rights, and gender. Because that once we are able to know what happens within the communities, what human rights principles our countries have signed on and committed to, and in terms of what are the gender sensitive responses that we need to take into consideration, then that in the process will also build the health systems. So we need a multi-sectoral approach that builds on partnership with private sector, civil society, and government. It should, the decision should not be unbalanced, meaning that the government should be the only making decisions. And we're seeing this in COVID response teams right now. Most of the decisions are being made by government officials. Civil society, especially local civil society, are nowhere on the table. It is time that we also thought, yes, we want international NGOs to be there, but I think it's also space that we need to develop, invest in communities, especially communities of HIV, people living with HIV, TB and malaria affected communities. We need to invest in community-based monitoring systems so that civil society and communities can be able to bring data and evidence on board. So thank you so much. These are some of the critical areas I have noted. Thank you.
Thank you. So in the interest of time, I'll take one last question, and this goes to Renuka. Can you share some of the learnings that we've had in the fight against malaria, HIV, TB, that we can actually adopt in the fight against COVID? This is a very important question. Over to you, Renuka.
Okay, thank you. I mean, I think the lessons are very obvious. I think several panelists alluded to what is similar when you have a global pandemic. The world becomes your stage and automatically brings in global actors, whether that's donors, governments, civil society, private sector, your development partners and NGOs. I mean, it becomes a global village at that point. HIV and TB and malaria have shown us ways in which we need to come together, work together for either making technology accessible, for developing health systems, for simply listening to the voice of the communities, but more importantly, for using all of that to mobilize enough resources at all levels, the country level and the global level, so that we're singing from the same song sheet, if you will. So I think for COVID-19 too, similar approaches and methodologies, if you will, if you can call them methodologies, should be practiced. You shouldn't reinvent from what you already know and have, and not make the same mistakes as were made with HIV, TB, and malaria. So having the data up front, for example, would be fundamental to look at an evidence-based programmatic movement. There's one thing that I want to say from the lessons learned perspective too, as these new COVID innovations, particularly in this field of diagnostics, are being developed and rolled out, it's almost like a call to action or just kind of a moment to pause and think, not to impose business as usual regulatory patterns, because we know that for diagnostics, that can be a really long process, and time is not something that we have at this point in time. So the FDA, WHO, everyone's come up with EUA, an emergency approval system, to fast track solutions, and that's what we need to be doing. Obviously, you have to pick for good, robust, quality solutions, but let's not create obstacles because it is not business as usual. And I would kind of put that in that context of learnings as well, in response to your question. Thank you.
Thank you so much, Veronica, and thanks to all our speakers for your insights and your thoughts on this topic. With your kind of leadership, we are very confident that we will win the fight against HIV, TB, and malaria, and COVID, and even more other diseases. We're impressed by the resilience and the work that you're doing so far, and we hope to continue the conversation and continue to fight till we achieve our desired goals collectively. At this point, I would like to welcome Ms. Zuera Yusufu, who is the Managing Director and CEO of the Aliko Dangote Foundation, to give a closing remark. Aliko Dangote Foundation is the largest private foundation in sub-Saharan Africa, based in Lagos, Nigeria. In her role, she leads the foundation efforts to improve the health, nutrition, education, and economic empowerment outcomes of Africans. They believe in providing solutions for Africans by Africans. Zuera, the floor is yours.
Thank you so much, Ochuko, and thank you everybody for a really interesting webinar. I think this was, it's good to just talk about what everybody's doing and how, you know, we shouldn't lose sight of our existing challenges when something new comes in. For me, what I'm taking away from this is several things. Something that Olive just said about having to count on ourselves and our own resources. I think the coronavirus pandemic has made it abundantly clear that there's no help coming from anywhere. Like, you know, every country seems to be freestyling a solution. There's no blueprint of success. Everybody's struggling with what to do, how do we get the cases down, you know, lockdown, déconfinement, progressively, you know, suddenly all the stuff that we're supposed to do. Yeah, and Ochuko, you said to mute our phone, sorry. So the reality of the struggle that everybody's going through makes it extra clear that our typical donors, our normal donors, are nowhere to be seen. And so, you know, the reality that we have to count on ourselves in Africa in particular is a point that is well taken. And, you know, just to let Olive know, this is what the private sector in Nigeria, which Bolanle had talked about earlier, is really looking to do. For us, again, like Bolanle said, you look at the numbers of affected people, sick people, dead people. COVID-19 is not anywhere near what we're seeing with the normal things that kill people in Africa. Malaria, HIV is not killing people as often, but Lassa fever, meningitis, people still die of things that can be avoided. If we just look at the malaria deaths, which are what, 300,000 people die of malaria in Nigeria alone. We have a few hundred people who died of COVID. So it's affecting us like it's affecting everybody, but it's not the horrible images that we're seeing of, you know, ICUs running out of room and things like that. We're just not seeing those numbers on the continent, but we're feeling the economic impact of the pandemic. So the reality of, you know, how does the private sector step in? How do we reorganize our resources? How do we work with the civil society? How do we, you know, engage with government so that we can effectively bring solutions to these problems is what I think all countries on the continent are doing when it comes to private sector engagement. And so really, thank you all for the time. Thank you for, you know, sticking through the call. It's been 2 hours now, so I think it's the perfect time to sign off. So thank you. Well done, Nancy, for putting this together. Well done, Ochuko. Like I said, my office mate, who I haven't seen, I think since February or March or something like that. But hopefully we'll be back in the office soon together. So thank you everybody for dialing in. You know, and let's keep our heads up. This is not the time to be discouraged or tired. We still have a long ways ahead of us. Thank you very much.
Thank you. Thank you, Zora. Thank you to all the participants of today's webinar. Thank you to all our speakers. Thank you for your time. We can't say thank you enough. More than ever, we must fight and continue to work together to ensure that our outwon gains against these diseases are not lost. And I believe that we will definitely get to our end desired goals. We will reach out to you with a follow-up on the summary of the webinar, and we will continue the conversation. Enjoy the rest of your day. Thank you.
Thank you. Bye-bye.
Thank you, everybody. Bye-bye.
Bye-bye.
Bye.